Health Minister Dr. Aaron Motsoaledi, who joins us to talk a little bit about the Stilfontein trapped illegal miners requesting for ARVs. Minister, very good evening to you. Thank you so much for your time. We know that a note believed to have been sent up by the miners still underground asking for antiretroviral medication has sparked a bit of controversy. What is your position on this request?
Good evening, Mpo, and good evening to the listeners and viewers out there. Look, when we heard this story from the press, because nobody wrote to us and told us anything about ARVs, we just heard it in the air from the press. I phoned my colleague, the Minister of Police, to ask him, is there any order that the Department of Health must supply anybody with any ARVs? Because we are not refusing to supply people with ARVs, but there must be prescription from doctors. And it's then that our health facilities must provide ARVs, not the National Department of Health from head office, because we are office bound, we are not clinicians. And the minister said there's no such an order. The order from court just said the police must not interfere with any operations that at the mine are there to help the people who are underground. So at the moment, we really don't know what is that which is wanted from the department. But if anybody wants ARVs, they must have been diagnosed by a doctor, which means a doctor must have examined them, diagnosed them HIV positive, and put up a prescription. That's how people get ARVs. We don't just take them in a suitcase and start distributing them among people. That will be very wrong.
There are some contradictions here, Minister, because what the SABC was reported to have said, Deputy National Police Commissioner responsible for policing, Tebello Musigidi, referenced the interim order that you speak about that was issued on Saturday that requested that police give the necessary medication that will ensure the safety of life. He said if the ARVs are one of the requests, they have indicated that it would be done in a coordinated manner. What would a coordinated manner mean?
I don't know what contradiction you are talking about. I'm saying to you, ARVs are not like Panado or vitamins. They are not over-the-counter medication, which you can just pack in a suitcase and give to anybody. They are prescribed by doctors first. And if any court of law wants doctors to go there and prescribe ARVs, we can't stop that. But just to say ARVs must be supplied, and then you say Deputy Commissioner of Police say they'll work on them in coordination.
Yeah.
I really don't understand. And I told the minister that, because as a Minister of Health, we don't prescribe ARVs. We make policies, and people go to hospitals. Because there's a policy that ARVs must be supplied, that hospital will be having ARVs, or they'll go to individual doctors. That doctor must first examine them and get satisfied that they are HIV positive and test them and say they are HIV positive and make a prescription of ARVs. If I just go there with ARVs, which ones am I going to give to who? Because I don't even know who's HIV positive there.
So what is the level of conversation between you and the Minister of Police? What approach will he be taking upon your advice? Because there seems that, you know, you're saying this cannot be done, and perhaps there was a level of thinking that it could possibly be done by the police, you know, as I speak about the Deputy National Police Commissioner. What is the conversation you're having?
What can the police do? If I put here hundreds of ARVs because they are so different and give them to police, can police dispense or prescribe medication to anybody? They can't. So I was saying, even me as a minister, I can't. And if there's any doctor who comes and say, here is my patient, I've prescribed ARVs for them, I want to give this patient the ARVs, then the police won't refuse. They'll say, go on. And I believe the order is about that. But people believe, no, the Minister of Health must pack ARVs in a suitcase and go there and distribute them among people. When has that ever happened with medication? The people who are HIV positive, the manner in which they get ARVs after doctors have prescribed are two. Either they go to that doctor every month, or they go to the chemist, to a pharmacy with a prescription. Maybe I forgot the third method, which is very big. We call it CCMD, Central Chronic Medication Dispensing and Distribution Program. This is where a person who's on ARVs, who has got a prescription by doctors on ARVs, come to us, give us an address where they would like to receive their ARVs without seen by a doctor or a nurse. They just give us any address. It might be a local store or somebody's business or somebody's offices or a school or whatever, if they are willing to do so. Then we look for a service provider who dispenses all these medicines, put them in a pack, and go to deliver them there. That's one way of delivering ARVs, but they've been prescribed for. We don't just pick ARVs and give to anybody. It must have been prescribed by a doctor. That is what I'm emphasizing.
Yeah.
And in this case, we don't know who's HIV positive, which doctor prescribed what, so we can't just give ARVs like that. That will be grossly irresponsible. And if there's any judge who believes that should be done, I mean, he must just be told that, judge, you have missed the point. ARVs are not magwinya or cold drink or water or food. They are prescribed drugs.
Yeah.
And they have to be a particular prescription for a particular person, because you may harm a person by giving them any medication out of your head.
Minister, you've emphasized that point enough. Just veering off slightly, the 21-day registration period announced by President Ramaphosa for spaza shops is only a small part to help curb the mounting deaths of poisoned children. Even as you and I speak, there was a case reported today, this week. What do you foresee as the bigger approach as you look at some of the loopholes and really addressing something that is of utmost importance, ensuring that there are measures of food safety that are implemented and that this is handled like it should be handled to avoid deaths?
Well, the president on Friday last week announced 3 different ways in which this matter can be resolved. The third one is how to prevent future events like this happening. And if you look at them, most of them are in health, and we're busy with them. The first one, which affects health, is that we need to have a team of experts from various areas in health: epidemiology, toxicology, pediatrics, because it's children who are dying, and forensic pathology and chemical pathology and all that. We are busy compiling that, and we think by the end of the week, the team will be available. This team will work like the Ministerial Advisory Committee that was working during COVID, that was informing the government on what to do. The second thing in health is that any child who dies anywhere, who is 12 years or younger, that death must be notified. That means it must be handled like a notifiable disease, which hitherto was not like that. The third one is the manner in which we handle death certificate or death. At the present moment, it's only the doctor who certifies the death, and health and home affairs won't know anything except to know that the person died from a natural or unnatural death. The exact cause of death is sent to State South Africa in a sealed envelope, and they'll release that when they release statistics, but they won't release the name of a person. Now, we believe all those must change, even if the name of the person may not be released to the public, but at least us in health must know, so that we have got a best-eyed view of what's happening.
Yeah. Minister, very quickly before we let you go, how will this team be capacitated? You barely have doctors and nurses. There's shortages in our hospitals and clinics as you and I speak. Where are the funds going to come from? How are you going to make this work?
These are doctors who are employed, by the way. We are just putting them together in a committee. They are not sitting at home. If you remember, during COVID, the team was chaired by Professor Salim Karim. He is employed as a professor in various universities and also in government and in Caprisa. And then there were other members. After him, the team was chaired by Professor colleague Mlisana, who is employed by NHLS. So all these team members who are choosing are employed either in the public sector or in the private sector. So we are not going to fetch anybody who's unemployed and put them there.
Very well. Thank you so much, Minister, for your time. Minister of Health, Dr. Aaron Motsoaledi, expanding there on the Stilfontein trapped miners and saying that ARVs will not be dispersed without a doctor's note.